my beloved lecturer, Sir Faris Ahmad. My name is Muhammad Shafi Haikal bin Osman. My metric number is 2020-871-702. Today, I am going to talk about bandaging. Bandage can reduce swelling, restrict movement, and provide support to the muscles, bones, and joints. Certain injuries may heal better when bandaged. These include fracture, sprain and strain, wound-like cuts and animal bites, and burns. Most minor hand injuries may heal on their own. Serious hand injuries require immediate medical assistance. Here are some common hand injuries that may require bandaging, as well as signs that you should seek medical assistance, which is fracture, sprain, strain, wounds, and burn. Different injuries require different bandage. Some bandage types include: first is compression bandage, also known as elastic roller bandage or grip bandage. This type of bandage includes a long strip of stretchy fabric packed in a tight rope. Compression bandage are used to support the bones, joint, and connective tissues in the hand after injuries such as sprain and strains. The second one is the gauze bandages. Gauze bandages are not technically bandages but dressings. A gauze dressing is a thick cotton pad used to cover medium to large size wounds. They may be held in place by tape or a roller bandage. Next is cotton or linen roller bandage. Similar to compression bandages, these bandages come in a roll. They typically used to hold gauze dressing in place. Next is adhesive or plaster bandages. Similar to gauze bandages, these are a type of dressing for wounds. Band-aid is one brand. They come in different shapes for smaller wounds and contain an adhesive so that they stick to the skin. Next one is tubular bandages. Tubular bandages are tube-shaped elastic bandages designed to fit around the fingers, elbows, or other areas of the body that move a lot. They may provide support or keep gauze dressing in place. Lastly is triangular bandages. These cotton bandages are versatile and are useful when giving first aid. They can be folded into a sling or used to apply pressure to a bleeding wound. Now, I will show you how to bandage a wounded hand. Alright, now I will show you how to do a bandaging. If you are treating a hand wound or burn, rinse the affected area and apply a sterile gauze dressing before wrapping your hand in a bandage. Open the roller bandage and start with the end of the rope at the inside of your wrist. Wrap the bandage twice around your wrist. The material should be flat against the wrist. From the inside of your wrist, pull the bandage diagonally across the top of your hand. The roll should now be inside your pinky finger. Pull the bandage around your pinky finger, under the finger to your pointer finger. Then pull it around the pointer finger and down diagonally across the top of your hand to the outside of your wrist. From here, wrap the bandage around the wrist once more. It should be where you started the wrapping at the inside of your wrist. Repeat step 4 to 6, creating a figure 8 like bandage around the hand and fingers. With each new figure 8, you should leave a half an inch of the previous layer visible. The upper part of the fingers should be visible. Once you have covered the whole hand with the bandage, secure it with a safety pin or clip. Alright, a little precautions. When bandaging your hand, take the following precaution to ensure a smooth healing process. The first one is avoid pulling the bandage tight. If you make the bandage too tight, it will cut off the circulation in your hand. To check if it's too tight, squeeze one of your fingernails and count to 5. The color should return to your fingernails within 2 seconds. If it doesn't, you should loosen it. Second, rub beyond the site of the injury. Wrapping the area surrounding the injury helps to ensure pressure is applied evenly. The third one is use a new gauze dressing or roller bandage. Reusing a gauze dressing or roller bandage can lead to an infection. And lastly, avoid bandaging a wound that's infected. If the injury site is red, hot, swollen or tender, you might have an infection. Yellow or green nipples, fevers and chills are additional signs of infection. So, this is how you do bandaging. For the conclusion, if you injured your hand, a bandage might be able to help in the healing process. If your hand injury is serious, you should seek treatment right away. If your hand injury is minor, a bandage can provide stability, reduce your chances of infection, and quicken healing time. So that's it for today. I hope you guys enjoy and understand what I'm trying to share with you guys today. So that's all from me. Thank you. Assalamualaikum. Have a nice day.
Sungguh menipu ada cintamu padanya. Hanyalah palsu ada ia mainan gada. Apa yang ada di hati ia kosong tak berharga. Dan kau tak beri segala. Sekadar kata siapapun boleh kata. Ungkapan cinta siapa-siapa pun